I'm 69 and I'm from USA. I was scheduled for hip replacement surgery in the United States, but they told me that it would be 4 or 5 months before I could get the surgery done. So I thought, well, I can't wait that long. I'm in tremendous pain. My name is Mark Mooney. I like hiking in the outdoors, in nature, and that's been closed off for me for many years now, this last 5 years. The final straw was not being able to walk to my store, my grocery store, without pain. So that was the straw that broke the camel's back, not being able to shop for my own food without being in terrible pain. My pain began like 10 years ago, just slowly, almost imperceptibly. I remember hiking, I felt a pain and I wasn't sure where it was coming from. I've only just diagnosed this as the problem. It took me all those many years to figure out that it wasn't my lower back, lumbar. It was this, my hip. And it just got worse until this last 3 years, it's gotten unbearable. I first saw a doctor for this pain in, I guess, 2017, 2016, and they took pictures of my lumbar, the facets, and it showed only mild arthritis. I don't know where I'm going to go with this and how useful it is to you to talk about the diagnosis of it, but for me it's amazing that it was missed all these many years. I probably could have had this surgery done maybe 4 years ago. Until this last 3 years, it's gotten unbearable. So I started looking on the internet. I looked far and wide. I looked in South America, I looked in Northern Europe, I looked in Southeast Asia, and I decided on this particular clinic because I'd been to Turkey before. Turkey I had been to before. I'd done balloon rides here. I went swimming in the Mediterranean in Antalya. I said, I'm coming back. It's got a very good self-presentation. And of course, the clinic recommends itself. A credibility, let me put it that way. Istanbul is very accessible from most areas of the United States. I mean, my flight from Seattle to Istanbul was only 11 and a half hours. I mean, I was here before you knew it, and a ride waiting at the airport. I'm in Bursa an hour and a half to 2 hours later. So you can't beat it. I mean, it's just very easy to access. Hiking and biking are two things that I used to do, and I'd like to do them again, unencumbered by any of this. That to me sounds great. If I can do that this trip, I'll consider myself very lucky. The experience overall was very positive. I mean, I went into the surgery room nervous and a little anxious, but when I was transferred from the gurney to the surgical table, everyone was the voices around me were very warm and polite, English speaking, and the next thing, I don't remember anything. And then before you know it, I'm emerging from anesthesia. And someone said to me, it's all over. And it was like the sweetest words I'd ever heard. It just is a remarkable journey that you take right away after surgery, right away. Physical therapy starts immediately. I was fitted with a mechanical boot that makes your leg go up and down a little bit, which helps the recovery process because it builds optimism in you that you're going to be getting better day by day. And so the following day, I did take a few steps with a walker. Remarkably exhilarating to be able to have no pain. I really want to see the snow in those mountains outside this window. And I think you have to take something called a téléphérique. This is the most exciting way to end my stay in Bursa. I mean, to go to the top of Mount Uludag on the téléphérique in blizzard conditions, very cold, but wonderful way to end my trip. Bursa will always have a special place in my heart because this is where I came for a life-changing surgery that will make the rest of my life wonderful. Everything about the experience, I mean, from the surgery to the nursing team, to the accommodations at the clinic, to the follow-up in the hotel after the recovery and rehabilitation, has so far exceeded my expectation. I would come here again if I could.